The Sancheti Institute for Orthopedics and Rehabilitation offers wide-ranging support to patients, especially with knee and hip joint problems. A world-renowned doctor, Dr. K.H. Sancheti is devoted in providing the highest degree of patient care. To fulfill this dream, he established a Center for Orthopedics, the Sancheti Institute of Orthopedics and Rehabilitation in Pune in 1972.
I had decided to become an orthopedic surgeon when I was a graduate student in BJ Medical College, Pune. I did MS Orthopedics in 1965 in the month of November and started practice in the month of December same year in Motwani's nursing home when I had only 100 rupees in my pocket to print the letterheads.
Dr. Sancheti has the unmatched distinction of being awarded the Padma Shri in 1991 and the Padma Bhushan in 2003. His expertise is blended with futuristic vision of his son, Dr. Parag Sancheti. An outstanding medical student, Dr. Parag Sancheti stood first in the University of Pune in the MS Orthopedics examination. He has specialized in the field of knee surgery with the latest medical knowledge in this subject. The 150-bedded Sancheti Institute is the largest specialized private orthopedic hospital in Southeast Asia. It offers all super specialties of orthopedics like joint replacement surgery, traumatology, spinal surgery, pediatric orthopedics, Ilizarov techniques, arthroscopy, rheumatology, and sports medicine, along with hand and plastic surgery. Dr. Sancheti also advocates holistic methods of cure and prevention. He is a strong advocate of regular exercise and balanced diet. Keeping this in mind, he started Sancheti Health Club, Knee Club and Spine Club, wherein not only the patients but also individuals without medical problems are given comprehensive exercise and rehabilitation program. The knee is one of the most marvelous joints in the human body. It is a joint where the thigh bone or femur meets the leg bone or tibia. It moves like a hinge, but it can also rotate and move a little from side to side. It is a major weight-bearing joint of the lower limb. The knee joint is held together by muscles, ligaments, and other important tissues. Unfortunately, the knee joint is also more likely to be damaged than most other joints due to various reasons. Most commonly in the elderly is development of degenerative arthritis.
Arthros means joint, itis means inflammation. So inflammation of a joint giving joint pain is arthritis. We come across various types of arthritis in our practice, but the two most commonly occurring arthritis are osteoarthritis and rheumatoid arthritis. Osteoarthritis is because of age. As the age advances, there is wear and tear of the joint, thereby the cartilage is getting worn out and causing osteoarthritis. Rheumatoid arthritis is something which can occur early in life, and this is an inflammatory type of arthritis which causes deformity and can affect multiple joints at a time, while osteoarthritis affects only one joint at a time.
Arthritis in India is very common in the knees as compared to Western people where hip arthritis is more common. Since our sitting habits on the ground and activities of daily living involving lot of knee movements, patient having more arthritis, I found that they have got less movement, more pain, more deformities, and they were crippled and miserable. Then I thought, why should we go to that situation? Before that we should do some corrective measures, and then I thought preventive action of teaching them exercises, motivating to do exercises in a proper way to develop muscles is essential to prevent arthritis and to prevent deformation. Then idea came of knee club, and we started a knee club, and there is a tremendous response.
The Knee Club endeavors to offer an integrated approach to knee problems, combining allopathy, physiotherapy, yoga and Ayurveda.
Once we put the patients on medicines, if the patient responds, his pain goes off, then it's fine. But in certain cases where the arthritis is advanced and the bone is deformed, then the medicines have a limited role. Because the cartilage is degenerated, the medicines cannot help to regenerate the cartilage. Whatever the arthritis process has set in, it cannot be reversed. Medicines can help to relieve the symptoms of the patient, to a certain extent modify the disease process. But once the cartilage is deformed and the joint is damaged, then the medicines do not help. What do we do in these patients? The treatment now which is available to us is of joint replacement surgery.
Dr. K. H. Sancheti is an expert in total knee replacement surgery, with over 1,000 such operations to his credit. You will be admitted one day prior to the surgery, and the pre-operative preparations will begin. The actual surgical procedure would take only about an hour, but the time taken for going in the OT and coming out to the recovery area will take about 3 hours. The operation theatre of Sancheti Hospital conforms to the best international standards. It has been specially designed for joint replacement surgery. It has a laminar airflow, air handling unit, and special coating over the wall and floor. This ensures a completely sterile and bacteria-free environment in the operation theatre. Once you're under anesthesia, the surgeon will begin by making an incision on your skin in front of the knee joint. After the skin incision, the capsule of the knee is opened to gain access to the knee joint properly. The muscles and the tendons are carefully dissected, and the knee is bent so that the bone ends are visible. 6 to 8 millimeters of the damaged joint surfaces is removed from the ends of the leg bone or tibia, and the thigh bone or femur, and patella or kneecap. Now it's time to place the femoral prosthesis, which is fixed in place using a special bone cement. Next, the tibial prosthesis is cemented to the top of the tibia. Soft tissue balancing will have to be done as required. The damaged undersurface of the kneecap is cut and replaced by a plastic component, which is also fixed with bone cement. Thus, all pre-existing deformities are corrected and the damaged bone is replaced by the artificial prosthesis. Finally, the incision is closed in layers and dressing is applied. Also, a drain is attached to the wound to take away excess and spoilt blood from the operated site. After your surgery is completed, you will be transported to the recovery room for close observation of your vital signs, circulation, and sensation in your feet. In the post-operative period, you will be given painkiller injections through the epidural catheter to reduce the pain. You will also be given antibiotics to prevent infection. Your doctors and nurses will support you, ensuring that you receive the best post-operative treatment. On the second day after the surgery will begin your exercise program. These exercises will be the key to further recovery and rehabilitation. An experienced and reputed physiotherapist will help you with the exercises and bring your knee functions to optimum. You will be walking within 3 to 5 days after surgery. Under special situations such as bone grafting, it would take a little longer for your mobilization. In the initial part of your physiotherapy, you will be given a walking aid like walker or crutches. In the hospital, the goals are to maximize post-operative knee movements and reduce knee pain. Within 3 months, 95% of your pain would have gone, and you would have achieved 100 to 110 degree of knee range of motion.
Oh my God, I am having a new life. I am so happy, so happy. They have made me stand, with confidence, and my quality of life has been beautiful now. So I am very, very happy, and actually the whole family has given me a lot of support, and as well as Dr. Sancheti. I feel perfectly normal even while sleeping, there's a main thing, I am so happy because I am getting a sound sleep. So that is the greatest boon I have, after this operation. As it is, I feel so fit, and I think, even when I go out, I think my personality is also changed now, I am much more happier, and the standing is also erect, when pain is there in the knee, you naturally you keep bending little bit, and when you stand without pain, then the conversation is so nice, you see. That is, then according to that the expressions are all there. So naturally, you see, the whole life changes.
For all of us at the Sancheti Institute, the biggest reward is a smile on your face as you move ahead in life. We are committed to ensuring that you will definitely have a better quality of life.